Hey everybody, excited today to take a little time and go over the Edneyville Fire and Rescue Fall Prevention Program, a community risk reduction program. It's Mike Ostrander. I'm a captain with the Edneyville Fire Department, and I'll be going over this plan with you today. So before we dive into the details of the program, first let's talk a little bit about what exactly a community risk reduction plan is. The primary purpose of a community risk reduction or CRR program is to identify risks, prioritize those risks, create a plan to eliminate the identified risk, and implement the plan. Additional purposes include evaluating the program, adjusting as needed, continuing to evaluate the program, and then assessing other risks that were previously identified. CRR programs involve partners, stakeholders, and members of the community. It's based on the 5 E's of life safety education, which are education, economic incentives, engineering, enforcement, and emergency response. So now let's talk about the problem, the prioritized identified risk that we found when we did our analysis. So the risk analysis portion of the program found that the Edneyville community actually has a problem with slips, trips, and falls, especially common an issue with the senior population. That's those that are 65 years of age or older. So you can see in this chart, we pulled some data from the emergency reporting software at Edneyville Fire Department. This actually breaks down major incident types from 2017 to 2022, 5-year period. Noticeably, the rescue and EMS is a substantial percentage of the calls that were ran, 48.57. Service calls, you can see, were 18.33. So this chart breaks that same information down further into number of incidents and the percentage of those of the total incidents. Again, assist EMS, other EMS calls is about 44%, and the assist envoy calls is right at 10%. That is what falls into that service category from the last slide. So this is a picture of a comparison between the United States and Henderson County, North Carolina, which is where Edneyville is located. And this is focusing on the age demographic. You can see the United States, the average age of persons 65 and over are about 17%, whereas in Henderson County, it's substantially higher at 26.6. So when we're developing a plan, we want to identify goals and objectives to be able to deliver the plan. It's important when we're developing a plan of action that clear goals have to be determined. They must be specific, measurable, achievable, realistic, and timely, or SMART. So identified goals and objectives of the fall prevention program we put together are to create a plan that produces immediate and long-term solutions for fall prevention. We want to foster supporting programs that reinforce a feeling of community. We want to build relationships between participating personnel, stakeholders, and the citizens. And we certainly want to promote a healthier population. Additional goals and objectives of this program: we want to provide education and resources to prolong the independence of the senior community. We want to identify communities that are hazards as is related to fall probability and the impact of those falls, and provide information to younger populations to try to prevent situations where these falls are occurring, both proactively as support for elders. So the timeline for this program is a little different just because of the way it was designed. So initial steps we would want to begin immediately. Completion of those first steps would occur within 30 days. We would evaluate those on completion. This program is actually designed to sustain itself, so the end of the timeline is unforeseen. So we're trying to implement a ongoing program. Some of the long-term goals could take a year or more to complete once they've been implemented. Some additional notes on the timeline. So each phase, this is broken into phases, but each phase of the program has independent benchmarks. These are actually going to be laid out when we go through the different phases. And new phases begin only when the program is ready to start that phase. So now we've kind of laid out the groundwork a little bit. Let's actually get into what the plan is. So the program plan is broken into several different steps, and then implementing those plans is actually done over 5 different phases. This first step we've actually already talked about a little bit. This is identifying, prioritizing, and justifying the risks. It's the initial step of any risk reduction plan. We have to find the risk. In this case, it was found to be fall prevention for those 65 and older. Right, so now we move on to step 2, which is the planning step. This is identifying a planning team and creating a plan that identifies target groups, resources available, funding available. This creates the goals and the tactics of the program. So the planning team for this project is so myself, my Ghost Trainer, I'm the program developer. I want to work with first responders, such as the fire department and Henderson County EMS. I want to work with people who have data and resources, Council on Aging, Department of Social Services, Meals on Wheels. I also want to work with some outreach, resources, programs, funding. People that can help with that are places like Lowe's and the YMCA. Alright, so we've identified the risks, we've prioritized those, we've gotten a planning team together, we've came up with some strategies and tactics. Now it's time to implement our plan. So after the tactics are decided, fundings, resources are obtained, the plan can begin. So this plan is a 5-phase plan. First phase is distribution. So this phase involves getting resources immediately available, focuses on getting that information out to the target group. We'll do this with tip sheets, flyers, and brochures. These are papers or pamphlets readily available from some of our partners. They might be handed out, placed into kiosks, provided by care partners, during home visits or other opportunities. Benchmarks for this are set at 30 and 90-day intervals repeatedly as that program continues. We'll also use newspaper articles, editorial write-ups, and interviews that can be printed. 46% of seniors 65 of age and older still use newspapers pretty reliably. So these will be performed by planners of the program to ensure accurate program information and that everybody involved is getting equal promotion. Benchmarks for this are set at 90 days. And then traditional and social media, using news interviews, commercials, social media posts, that's going to allow our messages to be spread. This will be handled also by the planners of the program to make sure everybody is getting an equal say and equal exposure. Benchmarks are set at 30-day intervals for evaluation and adjustment. So some other tactics in the distribution phase are door-to-door visits. So this provides program materials and information to some people that may otherwise be missed through canvassing or maybe they're not on social media. It develops relationships between our partners and the community. Benchmarks are set at 30 and 90-day intervals repeatedly. We'll use program partners. So using program partners helps us to gather data, reach out to the community. It helps us with resources such as program funding, actual resources, and development. Benchmarks for this are set at 30, 60, and 180-day intervals. And then the use of community advocates. So community advocates helps us to increase awareness of the risk programs and include all the special populations in messaging. So we find advocates from special needs communities, maybe it's culture differences, language differences. We identify those. They assist us in helping to build support for the program. They provide ideas that adapt the program to their particular special need and assist with the message delivery. Benchmarks for this are set at 30, 60, and 90-day intervals. Now we moved into phase two, which is existing program integration. Basically, we're taking programs that other providers have successfully launched, and we are including those and supporting those and letting them support our program to help establish boundaries, and also it brings establishment to our program. So some examples of these are the Remember When program. This is a program that was established by the NFPA, provides material focus and protocols, and it really relates to the fall prevention in the elderly. Um, Program provides 8 key fall prevention, 8 key fire safety messages aimed at the senior population. Benchmarks are established at 90 days just to determine if the program is still applicable. So the Silver Sneakers program, this is a low-cost option for fitness. It's aided by Medicaid, offers online and community fitness sessions for fall prevention, focused at seniors. It's usually done through groups like the YMCA. Um, it provides fitness opportunities, online, mobile apps, community class locations. Benchmarks for this are based in the current program, but will also be reevaluated 90 days to make sure it's still usable. The Steady program, that provides tools and resources to our target group. It basically is designed to assist in eliminating injuries, creating awareness for fall prevention. It really allows individuals to find resources. So these resources provide ways to reduce and prevent falls focused at older adults. Benchmarks, again, are based in the program, but will be reviewed every 90 days for applicability. So two other programs that we would integrate are the Healthy People 2030 program. This program focuses on healthier living among all the age groups and populations, but breaks them down into smaller groups and provides them precise information. The goal is to create a healthier population by the year 2030. Program integration and the resources they provide are actually a main aspect of this program. Benchmarks are based on their existing program parameters, but we will evaluate every 90 days to determine if it's still applicable. And also the Community Emergency Response Team, or CERT. So this actually allows local emergency responders. We provide basic disaster type response training to qualified members of the community. These members can then assist in disaster response or other needs as a resource to the emergency responders. Program goal is relation to fall prevention program, to develop a program to provide an additional resource for first responders. It also reduces the impacts of a fall by getting people to those fall victims faster and reducing the amount of time they're on the floor. Benchmarks are based on the existing program and will also be evaluated every 90 days. Phase three is the face-to-face phase. This is conducted by department personnel, well, stakeholders, program partners. This is basically home safety visits by personnel and other partners that have access to people's homes. It also gives professionals an opportunity to perform an evaluation or give personal suggestions for ways to make things safer. So home safety visits is a big one. So these interactions are an in-home or in-business evaluation. We go in and identify trip, fall hazards, fire hazards, and make recommendations for corrections. This allows responders and partners to provide a personal application rather than a general one, specific remediation. Benchmarks are set at 30, 60, and 180-day intervals to allow for evaluations and adjustments. There will be continued follow-up 180 days afterwards to determine the impact evaluation. Also, fire station tours. So this is another opportunity just for interaction between fire personnel, community members, and we can get on a personal level. This tends to increase the sense of community involvement and public interaction and is a valuable source of information. Benchmarks are on a quarterly schedule to determine if we need to adjust the information and also adjust the handouts. The next phase is events. This is phase 4. This is really the partners and stakeholders coming together and organizing events that the community is coming to. So it's another face-to-face, but the community is coming to us instead of vice versa. So open houses. This is put on by department personnel, program planners, sponsors, and it focuses on specific messaging. These will occur twice a year, with one of them being larger. The larger event includes more of the stakeholders, while the smaller ones focused primarily on the fire department. Benchmarks are 30, 60, 90, 120, and 180-day marks for review and adjustments. The Community Safety Summit, this is similar to an open house, but it's an annual event, and the safety partners come together and they promote their individual messaging that's important to them. It's held in areas where the target groups are located, and it tells the community that all of the partners are interested in their safety and their health. Benchmarks are similar to the open house, with the addition of a 30-day evaluation to determine the effectiveness. And exercise sessions, these bring members of the population together with local fitness trainers, and they focus on fall prevention fitness. They provide them different resources. These sessions are led by program partners, and benchmarks are set at 90 days. Phase of the program focuses on long-term goals and legislation. This legislation includes some that's focused on aiding the elderly by providing programs and resources, additional funding for them to get the tools that they need, to make improvements to their home, to do fitness without having to take that financial burden. Benchmarks for that are 180 and 365 days. Residential sprinklers really focuses on pushing to make sure all new residential properties are fitted with sprinkler systems, and renovations to existing properties are upfitted with sprinkler systems. This helps to provide a safe route for especially the vulnerable populations to be able to get out. Benchmarks for this are 180 and 365 days. And then there's the Community Public Servant, or the CPS program, which gives training to community members. It's kind of like a CERT program, but not disaster focused, or the volunteer firefighters, but you don't have to have all the certifications. But they're designed to provide support for public service type calls when they're needed. Builds community self-support, and provides relief to the first responder staff and demands, but it reduces the time on the ground for the people that fail. Benchmarks are 90, 120, 180, and 365 days. Quick review of the resources that would be required for the program. The initial program estimated cost is about $34,000. This is over the planning and 5 phases of the program. A lot of these are not recurring costs, so training aids and stuff like that would come out. So it would not be $34,000 every year, but these costs were offset by partner support and federal and state grants. The phase design actually allows us to gradually implement it, so we would only begin a new phase when the resources were available and the program was ready. Some of the identified stakeholders in this program are Edneyville Fire and Rescue Department, Department of Social Services, the Social Security Administration, Lowe's, and Home Depot, the NFPA, Henderson County EMS, Silver Sneakers program, including like Planet Fitness, YMCA, and the Pump House, Council on Aging, and the USFA. Project supporting partners and agencies include the Meals on Wheels, YMCA, AARP, the USDA, the Ring Community, Henderson County Emergency Management, Uber, Lyft, Life Alert, and Knox Security Systems. Thanks again for all your time today. Again, my name is Mike Ostrander. I'm with the Edneyville Fire Department. If you have any information, you can see my contact information on the screen, and we look forward to a successful program.